Stop bleeding gums, the nutritional solutions your dentist won't tell you. Do your gums bleed when you brush your teeth? You're not alone in wondering. I brush my teeth twice a day and get regular dental cleanings. Why does this still happen to me? Hello, this is Jenny. Over 50% of adults experience bleeding gums, yet most don't realize that despite diligent oral hygiene routines, regular brushing, flossing, and mouthwash use, many people continue to struggle with swollen, red, tender, and bleeding gums. This causes discomfort, difficulty eating, and self-consciousness about their smile. The truth is that healthy gums require more than just clean teeth. They need a comprehensive approach that combines proper oral care with targeted nutritional solutions that address the root causes of gum inflammation and weakness. Underlying causes of bleeding gums. Swollen and bleeding gums result from multiple interconnected factors that weaken gum tissue and compromise your immune system's ability to control inflammation. Understanding these causes helps explain why traditional dental care alone may not solve persistent gum problems. Primary bacterial causes. Plaque and tartar buildup along the gum line are the most common immediate causes of bleeding gums. These bacterial deposits create constant irritation, leading to gingivitis, the early stage of gum disease characterized by inflammation, redness, and bleeding. If left unaddressed, gingivitis can progress to periodontitis, a more serious condition involving deeper tissue damage and potential tooth loss. Oral care factors. Poor oral hygiene practices. Irregular brushing and flossing allow harmful bacteria to thrive in your mouth, creating the perfect environment for gum inflammation. Improper brushing and flossing techniques. Aggressive brushing with hard-bristled toothbrushes or improper flossing technique can damage the delicate gum tissue, creating entry points for bacteria. Lifestyle and dietary factors. Modern processed diet. Processed foods, sugary and refined carbohydrates, lacking essential nutrients and high in inflammatory compounds, can feed harmful bacteria in the mouth. Additionally, food processing methods strip away vital trace minerals, vitamins, and cofactors necessary for optimal gum tissue function and repair. Nutrient deficiency. Inadequate intake of essential nutrients, such as vitamin C, vitamin D, and zinc, can significantly impact gum health, weakening tissues, impairing immune function, and hindering the body's ability to repair and protect gum tissue. Chronic stress effects. Ongoing stress rapidly depletes B vitamins, vitamin C, and magnesium faster than normal dietary intake can replace them. Medical and hormonal factors. Medication side effects. Certain medications can contribute to gum problems by reducing saliva production or interfering with nutrient absorption, including blood pressure medications, antidepressants, antihistamines, blood-thinning medications, as well as oral contraceptives affecting hormone levels and gum sensitivity. Hormonal fluctuations. Hormonal changes during pregnancy, puberty, menstruation, menopause, and thyroid disorders can increase blood flow to the gums, making them more sensitive and susceptible to irritation and bleeding. Age-related changes. As we age, reduced nutrient absorption, cellular energy production, and slower tissue repair capacity can impact gum health and contribute to bleeding gums. Underlying health conditions. Various health conditions such as diabetes, immune system disorders, blood disorders like leukemia, and infections in teeth or gums can manifest as gum problems, affecting circulation, healing, immune response, and inflammation control in the gums. The nutritional connection. While bacterial plaque certainly plays a role in gum disease, the real question is, why can't your gums effectively defend themselves against these everyday bacterial challenges? This is where traditional dental treatments may provide temporary relief but often fail to solve persistent gum problems. They address the bacterial symptoms without correcting the underlying nutritional deficiencies that make your gums vulnerable, inflamed, and prone to bleeding in the first place. Your gum tissues need robust nutritional support to maintain strong tissue structure, mount effective immune responses against harmful bacteria, and repair themselves from constant exposure to food particles, bacteria, and mechanical stress. Nutritional solutions. Here are the essential nutrients that help improve gum health and reduce swollen and bleeding symptoms. Vitamin C. Vitamin C serves as the primary building block for collagen, the protein that gives your gum tissue its strength and structure. Even mild deficiencies lead to weakened blood vessels, making gums prone to bleeding with minimal pressure. Severe deficiency can lead to scurvy. Sources include citrus fruits, strawberries, and bell peppers. Vitamin D. The sunshine vitamin D regulates immune responses and supports gum health by controlling inflammation throughout your body. Low vitamin D levels correlate strongly with increased risk of periodontal disease, deeper gum pockets, and bone loss around teeth. Sun exposure is a natural source of vitamin D, but it can also be obtained through fatty fish, egg yolks, and fortified foods. B-complex vitamins. Vitamin B6, B12, and folate are essential for DNA synthesis and cellular repair processes that keep gum tissue healthy. Food sources include whole grains, leafy greens, eggs, dairy products, legumes, nuts, seeds, and meat. Vitamin K. Vitamin K supports proper blood clotting and tissue repair. Found in fermented foods like natto, cheese, and sauerkraut, as well as animal products like egg yolks and liver. Trace minerals. Zinc, selenium, and magnesium serve as cofactors in hundreds of enzymatic processes involved in tissue healing and immune responses. Even minor deficiencies can impair your gums' ability to repair themselves and resist bacterial challenges. Found in pumpkin seeds, chickpeas, cashews, spinach, avocado, and dark chocolate. Comprehensive supplements. Quality comprehensive supplements provide a well-balanced network of essential vitamins, minerals, and trace elements. While relying solely on a daily diet may not provide a sufficient and balanced array of nutrients in modern times, opting for a comprehensive health supplement is a convenient and effective choice. Omega-3 fatty acids. EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid, work at the cellular level to benefit gum health by reducing the inflammatory cascades that lead to gum swelling, bleeding, and tissue destruction. Sources include fatty fish, chia seeds, walnuts, as well as supplementation. Coenzyme Q10. CoQ10 promotes gum healing, supports tissue repair, and helps resist bacterial invasion. Present in beef, soy oil, peanuts, and health supplements. Probiotics. Probiotics address gum health by helping maintain bacterial balance in your mouth while improving nutrient absorption in your digestive system. Consume yogurt, kefir, kimchi, and fermented pickles for natural supply. Quality probiotic supplements are also a good source. Common remedies that enhance nutritional healing. When addressing swollen and bleeding gums, lifestyle modifications, oral hygiene practices, and targeted nutritional interventions are key components of an effective treatment plan. Immediate home relief. Begin your journey to soothe swollen and bleeding gums with simple home remedies that provide instant relief and support oral health. Cold compress. Apply an ice pack or cold cloth to the cheek for 10 to 15 minutes to reduce swelling. Oil pulling. Swish coconut or sesame oil for 10 to 15 minutes to reduce plaque and bacteria. Tea bags. Apply a damp, cooled black tea bag directly to the gum to reduce bleeding. Natural anti-inflammatories. Use diluted tea tree oil, aloe vera gel, or chamomile tea rinses for soothing relief. Proper oral hygiene practices. This basic but essential practice involves brushing gently at least twice a day and flossing daily to remove plaque, plus rinsing with warm salt water. Pay attention to thorough cleaning along the gum lines properly. If gums are inflamed, use an extra soft toothbrush. New flossing habits often cause temporary bleeding that should stop within a week. If necessary, use antiseptic mouthwash. Dietary changes. What you eat directly impacts your gum health by either feeding harmful bacteria or providing the nutrients your gums need to stay strong and resist infection. Reduce sugar intake and refined carbohydrates. Focus on whole foods rich in antioxidants, including colorful vegetables and fruits, that provide natural vitamin C and bioflavonoids. Avoid irritants such as tobacco products, alcohol, and very hard, crunchy foods. Proper hydration to maintain the saliva production, support nutrient transport, and flush away harmful bacteria. Stress management. Engage in regular exercise, meditation, adequate sleep, and stress reduction techniques help preserve essential nutrients while supporting overall immune function. Proper supplementation. Take supplements with meals, improves absorption of fat-soluble vitamins, and reduces digestive upset. Space supplements throughout the day for consistent blood levels of nutrients and optimal effectiveness. Regular dental checkups. Visit your dentist at least twice a year for professional cleaning to remove tartar and address any underlying infections. Manage underlying health conditions. Properly manage health issues like diabetes, autoimmune disorders, and hormonal imbalances that can contribute to gum problems. Seeking professional care. If bleeding persists for more than a few days, worsens, or is accompanied by pain, loose teeth, bad breath, signs of infection, or fever, seek prompt dental or medical care. Bleeding and swollen gums serve as a signal from your body, indicating a demand for vital nutrients crucial to sustaining robust and resilient gum tissue. Your gums possess remarkable healing capacity when given the proper building blocks for repair and defense. By combining meticulous oral hygiene with comprehensive nutritional support, you can restore the healthy, pain-free gums you deserve, while tackling the underlying factors that conventional dental care often overlooks. Thank you for watching. Please subscribe, like, and share this channel to receive more updates on health and anti-aging. Bye for now, and see you again soon.